Hello, I am Dr. Sujoy Dasgupta, consultant gynecologist and infertility and IVF specialist. Sometimes, unfortunately, you get to see some pregnant women who are coming to our clinic with miscarriage. They are asking, Doctor, I had miscarriage. So if I keep this pregnancy inside my womb, it will cause infection. So I need to do DNC, or that is the wash, that is called the operation, dilatation and curettage immediately. Is it? The answer is no. Having miscarriage does not always mean that you have to go for surgery, that is DNC, dilatation, curettage or operation. You have other options. What are the other options? Number one option is called conservative treatment. That is, you don't have to do anything. The pregnancy may spontaneously get out of the womb. This is called conservative treatment and the success rate is 50%. That is, out of 100 women, if we don't do anything, 50 women, the pregnancy will expel out spontaneously. Second option is we can give some medicine vaginally so that your pregnancy will be expelled out. This is called medical management. And the success rate is 80%. That is, out of 100 women, 80 can expel the baby with medicine. And the third option is called DNC, that is operation, commonly known as wash, that is dilatation and curettage. This is called surgical treatment and the success rate is 95%. Now, every option has its own merits and demerits. Regarding surgery, the merit is that it's predictable, that is, you can get admitted to the hospital according to convenient time of your doctor and yourself. After operation, if everything goes well, you can come back home within 2 to 3 hours. But the problem is that in 5% cases, surgery may not be sufficient enough. You may require repeat surgery or some medicine, because even after surgery, some parts of the baby may remain inside the womb. And remember, this operation is very safe operation, but just like crossing the road, accidents can happen. Similarly, out of 1,000 women undergoing this operation, one can have serious complications like bleeding, infection and injury to organs like bladder, like foot pipe or uterus. In that case, very rarely you may require cutting the tummy and repairing those organs. But remember, this complication is very rare. Therefore, surgery, that is DNC, has the benefits, but at the same time, it definitely has some risks. Second one is giving medicine. Medicine, the success rate is 80%. You don't have to get admitted to the hospital. But if you are taking the medicine, remember, after 3 weeks, you have to do urine pregnancy test at home to ensure that the baby has expelled completely. But remember, please don't do any ultrasound scan after 3 weeks, because if you are doing ultrasound scan will always show that there is something inside the uterus, and you don't do DNC just because ultrasound is showing something inside the uterus. Just do urine pregnancy test. If it is negative, don't do ultrasound. If it is pregnancy, you have to talk to the doctor. The success rate with medical treatment, that is giving medicine, is 80%, as I have already mentioned. There may be some minor side effects like pain, like vomiting, like loose motion. This can happen. But sometimes medical treatment can have problem, like sometimes the bleeding may be severe and yet can be unpredictable. That is, sometimes, very rarely, you can have severe bleeding in the midnight. In that case, you have to get admitted to the hospital in emergency. The other option, I said conservative, that is doing nothing. In that case, in 50% chances that it can get expelled completely. But again, you have to do urine pregnancy test after 3 weeks. But again, don't do ultrasound after 3 weeks. And sometimes again, it can fail, and you may require some other treatment like medicine or surgery. Therefore, having miscarriage does not always mean that you have to go for DNC or wash operation. You can try medicine or you can do nothing, because it can expel out spontaneously. When you should do surgery, definitely, if you are having severe bleeding or you are having infection. Remember, if you delay some weeks after having miscarriage, if you wait for medical treatment or operation, the risk of infection is not increased. Therefore, rest assured, always you may not require any surgery. Medicines may work well. Thank you for watching this video. If you have any further queries, don't hesitate to contact us through our Facebook page or YouTube channel.